presenter is Melony Sexton, and she's going to talk about blood pressure parameters for home care patients.
Hi.
And Diane, I'm sorry.
I'll say it, yeah. This is Diane Monday, and she works with me in home care, Crillon Home Care and Hospice. I'm Melony Sexton. And we've been working on this to try to bring us to accountability for our blood pressures. So as she said, it is, the title is Blood Pressure Parameters for Home Care Patients. The impetus for this study was basically the Centers for Medicare and Medicaid, HHQI division, as one of their initiatives was to improve the blood pressures of home care patients. And at the time that we started this, we didn't have any parameters. For physicians, patients that had no set parameters by their physician, we had nothing to go upon. So we're going into this just trying to improve and to set forth some parameters. Our project goals were to provide blood pressure parameters for cardiac patients. We're going to start with that population first, with the purpose of guidelines for notification of the physician, patient teaching to enhance their self-management, and to improve the quality of life, and most importantly, to reduce rehospitalizations. The background information was pretty interesting. Here's a couple of things that we found, that 4 out of 10 causes of death in the United States in 2012 were directly impacted by hypertension, heart disease, stroke, diabetes, and kidney disease were the top 4. And also it's estimated just a 5-millimeter drop in their systolic blood pressure in the population would result in a 14% overall reduction in mortality due to stroke, 9% due to CAD, and 7% all-cause mortality. Another thing that we found that was quite interesting is that in the literature there was documentation that blood pressure parameters were better done at home instead of in the doctor's office, and that really gives us clout in what we do with our telehealth units. And patients have blood pressure monitors, we teach them to self-monitor, and we look at their records and that sort of thing. So it's a lot of teaching goes into this, as well as just documenting what their natural environment blood pressures are. Okay, this is yours, Diane.
Thank you. Melony was talking about we're in a great position because of that. We treat blood pressure as that white coat syndrome, right? And that's not true. That's not true blood pressure measurement for their day-to-day. So in home health, we're really in a great position to do that. We conducted a literature review of scholarly articles. We benchmarked with the nurse specialists and the intensive care units at RMH. Some of the literature we got from the Journal of American Cardiology, from the American Heart Association, from the National Heart, Lung, and Blood Institute, NIH, and the CDC. The parameters were selected from those most recent scholarly articles, and many referred back to the 7th and 8th Joint National Committee reports on blood pressure. With HHQI's cardiovascular health improvement initiatives, this was based on the ABCs of the Million Hearts campaign. So in home health, we decided to start with that B of blood pressure. The focus of HHQI was to have a blood pressure of less than 140/90 at time of discharge. And we looked at the national averages of discharge blood pressures in home health and saw there was definitely room for improvement, with 18 to 23% of home health patients being discharged with blood pressures greater than 140/90. So our conclusion showed there is a need, and this need of when we always prefer parameters set by the physician, individualized parameters, but when they're not present, these parameters were established based on that literature review. Melony was talking about utilizing telehealth in the home, and we have a flyer about telehealth out at our poster, but it's a wonderful unit that we put in at no charge to the patient. And it monitors, we teach them to self-monitor weight, blood pressure, pulse ox, and pulse on a daily basis, and we teach them the parameters. It's surprising the number, we have surveys, we ask them, the number of patients that don't have a clue what the goal is for their blood pressure. They just don't know. So we looked, focusing first at our cardiac patients. The first parameter says cardiac patients without hypertension. That's a rarity, isn't it? That's a rarity. And you're going, 120/80, you're worried about that? And the National Heart, Lung, and Blood Institute says this is not a diagnosis, but it's an indicator of pre-hypertension if that blood pressure is over 120/80. And so at that time, we need to be teaching the patient about lifestyle modifications and paying attention to that blood pressure. If our cardiac patient has a blood pressure with hypertension of greater than 140/90, we're contacting the physician. If they have a diagnosis of uncontrolled or stage 2 hypertension, a blood pressure greater than 160/100, we'd certainly be notifying the physician. If they have atherosclerotic heart disease or stroke, a blood pressure of greater than 140/90 is when we're contacting the physician. Our next steps. In January, we presented these parameters to our staff. And at the beginning of 2016, staff were to implement these parameters. We have ongoing evaluation of our patients selected by HHQI randomly and their blood pressures at discharge. We just began in January, the data is a quarter delay in coming back to us. Zig Ziglar said, if you aim at nothing, you'll hit it every time. So we want to have a goal. And now we do have a goal for parameters, a goal to say to our patients, this is education for lifestyle management, and this is a goal for us to shoot for. And we believe that in helping our patients to better self-manage their care, their blood pressure, that we're really supporting the Carillion mission of improving the health of the community that we serve. Any questions? Nancy?
What kind of responses are you getting when you call physicians about
So,
those? Like if they're in those, like just over 120, over 80?
What I would expect is that the staff is just shooting them an in-basket message is my hope, and they're not sending out flares and red alerts and having them page down. They would use their judgment in how extreme, if they need to be paging them or getting their attention right away. I am not aware of responses as of yet. Any other questions? Yes, ma'am.
When you have in there discharge of patient, discharge from the home health service?
Yes, yes. We look at their discharge visit and use that as a milestone. And just as you have patients that leave AMA, right, or that may choose not adhere. We don't want to say we don't want to adhere to the guidelines. Some patients at discharge, it can be high in spite of everything correct, but if you look at the overall number of patients, that should be very low. Hopefully we have some impact.
Okay, thank you very much.